It's where all my friends are.
Facebook friends.
Who I avoid in real life.
Exactly. They were just imaginary friends.
Yeah.
Yeah.
It's where all my friends are. All right, let me put that on mute.
Later on, I'm going to have to ask you to show me on Earth how you'd stream to YouTube at the same time. I had no idea you could do this.
You've got to set it up, but basically, it's just a button at the bottom which says more. You can stream it to
easy
from YouTube.
Right.
Yeah, it's really easy. Okay, right. I have actually made some notes. Let me bring up, and then we will get.
I'm glad someone has.
Rocking. Okay, and I'm recording as well, just so I can do that. I do like that recording in progress. Okay, everybody. I will be on and off camera. Actually, I'll be off camera probably most of it. If you don't know Andy, he's the creator of IEMT and also Metaphors of Movement as well. In his recent work, he's been involved with the sort of how the brain hemispheres communicate with the body. And I actually put some images out, which Andy sent me over, which I'll distribute as well. And like I said, I actually saw him talk about this particular thing quite recently on another interview from another IEMT. Like I say, his name escapes me at the moment, but I found it really interesting. And so I'm always interested to learn more about IEMT, basically, and how the brain kind of communicates with itself and with the body, and basically how we can then use that as how we can actually use that within IEMT and also Metaphors of Movement, and if there's any other therapies that are relevant as well, we'd like to know. So I'm going to pass over to Andy, who's in his attic, and he's got a flip chart and hopefully some Sharpies and stuff. So Andy, over to you. How does the brain communicate with the body?
Thank you, Matt. Thank you for having me. And thank you to everyone for being here. I just need to give an explanation. If there's strange noises coming through my microphone, it's not me. It's because I'm in the attic. We live with a seagull. I mean, I don't know if people know. It's now 30 years old, this seagull, and it's got a dodgy leg, hence he's called Stumpy, and they're building a nest right above my head right now. And so the strange scratchy noises and weird chirping noises is the sounds of seagull love, and soon it'll be the sound of seagull cheeps as they all try and get in through the window, which they tried to do last year. All right, so I'm Andy. Thank you, Matt. A little bit about the brain. Now, I'm not going to repeat anything from the IEMT training, so I'll assume everyone has a working knowledge of what IEMT entails. Back in the 90s, I was working in neurosurgery, and it's one of those things I used to work in neurosurgery because I know it impresses people, and I've been hanging on to that ever since. I was a very lowly member of staff in the department, so it was nothing too particularly grandiose. Now, it gave me access to a whole bunch of brilliant minds, absolute genius level brain surgeons and senior nurses and so forth. So it's a steep learning curve and taught me a lot of stuff. Now, around about that time, I was really into all the NLP stuff, but neuro side of the neuro-linguistic programming, since that was my area of work and to a degree my area of expertise. And I was horrified at a lot of what I was hearing being cited as neuroscience by therapists, practitioners, alphabet therapists, and so forth. Now, one of the things I got curious about, does the brain hallucinate emotions? My reasoning was this. So we make pictures in our heads. And so the average ordinary person who's not been exposed to an NLP type education, the pictures are in your head. What we start to learn is that actually we experience those pictures in three-dimensional space. And so we can put a picture out there it's dissociated, it's in a frame, it's moving, it's color, and so forth, all the submodalities of a picture. So we have non-localized experience, non-localized consciousness. Now, one of the things I was already aware of through working with things like phantom limb pain is that consciousness actually isn't just located in the brain. One of the suggestions for a very, very long time has been we only experience consciousness in our heads because that's where our eyeballs are and our mouth. If we had eyeballs in the center of our chest and a mouth, say, in your elbow, which would be a bit weird, you wouldn't necessarily experience consciousness as being in your head. It's just that that's where our predominant thing is going on. So that's where we experience the world. So I got thinking about this kind of stuff. When people have an amputation, an amputated limb, they often have a phantom limb. So the brain is still mapping out the limb. And this can be problematic to people, especially if the limb is sticking through the floor, if they're sitting on the floor and it's at a funny angle. There is no limb there, it's been amputated, but the phantom goes through the floor, giving people some very peculiar experiences. Now, that was an area that I had been working with a lot, both hospital-wise, but also privately as well, in working with basically non-localized consciousness as a result in phantom limb pain. My question was this: does the body hallucinate, or does the brain hallucinate kinesthetics? And the easiest way to find this out was to ask, I had to really push on this one, ask the ethics committee and various senior clinicians for permission to go and interview people who were tetraplegic. So these are people who are basically like Superman, Christopher Reeve. From the chin down, they have nothing. They can't even breathe. So they'll be on a ventilator as well as everything else, total life support. Switch that off, they're gone within a few minutes. So these are people who basically have virtually no communication down the spinal column between the brain and the body. Now, the question I wanted to ask, now especially me in front of the ethics committee asking, I want to ask them one question: how do you feel? It's an ambiguous question. It can be read in many ways, but how do you feel? And what are feelings you feel? And after some persuasion, I managed to, one of the senior clinicians said, yeah, I can put you in contact with a few people. So I got to ask them, how do you feel? And the answer came back is they don't. And I thought, oh, now there's an interesting thing. A lot of people, see, not everyone makes feelings in the body. A lot of people make feelings in their mind, but a lot of people have somatic expression of their kinesthetics. I wanted to know, would those people still make somatic expression? Because if it's a hallucination, there's no information passing down the spinal column. It doesn't matter. So that if it's a hallucination, they will still experience it in the body. They didn't. And I thought, oh, so there is transmission of data between brain and body in a relationship that sends a signal into the body. You get a somatic response from the nervous system, which then creates sensation, which then comes back up to the brain. And you then detect how you feel in the body. And endocrinology and all the rest, there's lots of other systems that are involved in this. So I thought, now that catches my attention. So now I'm thinking, what about these projections out there? What would affect those things? Now I also wanted to know, what about information that's exchanged between the two hemispheres? Because a lot of people have some very, very strange experiences. You wake up in a mood in absence of any trigger. You can make up all sorts of stories in your head about having arguments with people that don't exist. At least not in the physical space in which you're having an argument with them, but of course you're having an argument with yourself. And so I started to look at how can the division of labor between the two hemispheres, which is asymmetrical, how can that be used to explain some of these phenomena? I tell myself to cheer up. Now, the left brain, this is a huge generalization, so forgive me any clinicians in the room. The left brain is largely dominant to language. And it's regarded as the dominant hemisphere, it's the conscious hemisphere. The right brain is the non-dominant, largely emotional and imagistic hemisphere, and largely the unconscious hemisphere. There's lots and lots of exceptions to this. If I tell myself to cheer up, that is left brain talking to right brain. And right brain may or may not be able to respond to that. There's a famous case of somebody who'd had surgery to reduce epilepsy, and she'd had her corpus callosum cut. The corpus callosum is the band of fibers between the two hemispheres. And so now the two hemispheres are unable to communicate directly to each other. So what would happen is this hemisphere is controlling this side of the body, and this hemisphere is controlling this side of the body. They can't integrate information across the hemispheres. They have to integrate information through the body. And what this lady would find herself doing is that when she would open up the wardrobe to pull out a dress, both hands would select a different dress. Because the two hemispheres had different ideas as to what on earth they were going to wear that day. Left hemisphere, which controls the right hand, is dominant. So basically, right hand dress wins. And sometimes she would find her hands would argue with the other hand and slap it away, because this is the brain communicating directly to the other hemisphere, because it can't go across the corpus callosum. So the communication has to be displaced elsewhere. Now, in the literature, there are dozens of case studies written up of people that have had the corpus callosum severed, which is done sometimes to control things like epilepsy, because it localizes it to a particular region of the brain, so it doesn't generalize across the whole brain to cause seizures. The famous one is the lady that woke up. Now, she hadn't had a commiserotomy, which is what they call the severing of the corpus callosum. She woke up one morning to her left hand strangling her. And she has what's called alien hand syndrome. This is a real syndrome. There's movies made about this kind of stuff, usually a horror thing. So she wakes up with her left hand wrapped around the throat, squeezing. And she has to wrestle the left hand away, and the whole time it's trying to kill her. Now, as you can imagine, there's some concerns are raised about this particular scenario. She gets taken to ER, given a brain scan, and she's actually had a massive bleed in the brain resulting from a tumor, which subsequently killed her. Now, in the analysis of what the hell's going on here, she had been depressed for a very long time and had a history of suicidal ideation. And that her way of dealing with that was to talk herself out of it. Now, essentially, the right hemisphere of her brain is depressed. The left hemisphere of the brain is not depressed. As an explanation, when people are depressed, it's very rarely the whole brain that's depressed. Different lobes or different hemispheres can be depressed, and that will affect the symptoms people raise. And when we treat depression, you've got to be treating the right particular hemisphere or the right lobe of the brain that's depressed. And you've got to analyze the symptoms, get it right, as opposed to just treat depression as a single entity. But we can do that on another day if we wish. So she was no longer, because of the bleed had damaged the corpus callosum, there was no ability for her to talk herself out of being depressed. Right hemisphere now is unbridled, and now, by in control of the left hand, can actually commit suicide. Actually, what's happening is the right hemisphere is trying to kill itself. The left hemisphere is trying to stay alive. Can you imagine the confusion inside that lady's head? Oh, that's called depression. That's what it looks like. That's anxiety. That's any disorder where you have a discrepancy between the two hemispheres. You've met people who are globally, they're basically a miserable fucker. They don't know they're depressed. This is their way of life. They are totally congruent with it. And that's because all of the brain is in that state. It's like when you're partially angry, you're furious, say, with your spouse about something, but you're able to suppress it and handle it. Because you're not completely angry. Only part of you is angry. The rest of you is able to take control of it. Yet we all know the angry person, the person who's always angry about everything all the time. They are congruently angry. And they may well be diagnosed with some sort of personality disorder, because actually all the parts of the brain are congruent with that state. So we get these part brain states as well. So now to Andy's model for the corpus callosum, got me looking a little bit further. You see, the corpus callosum is largely described as a band of fibers that allows integration of information or information to travel across the hemispheres to the other hemisphere. Is it, though, just that, or does it actually have other functions too? Maybe it actually has an integrative function, and actually does more than just be a conduit for information to flow through it. It would seem a waste to have all those complex fibers and all those complex neurons, and actually all they do is convey information across. Corpus callosum is a pretty big structure. It does have an integrative function. So, to the model. If just interrupt, if anyone has any questions or any additional stories, do interrupt. Allow me to go to my flip chart. The reason I use the flip chart is simply because whenever I try to do anything with technology, including like PowerPoint, remember the old slide projectors? They never work, do they? They never work. You always spend 10 minutes watching the presenter trying to get the sodding thing to work. So I figured I'd never use them. You can't go wrong with a flip chart and pens. Right, so we've got two hemispheres of the brain. Allow me to move the microphone so you can still hear me. Two hemispheres of the brain. We have the left hemisphere and the right hemisphere. They would normally be a little bit closer together than that. However, for our purposes here, we'll keep them just to make it easier for drawing. Now, the left hemisphere has a number of asymmetrical functions that the right hemisphere doesn't have. This is a gross generalization. There are thousands of counterexamples, so please don't list out all the counterexamples. And basically, largely depends on which books you read, because you have two schools of neuroscience, theoretical and functional. In functional, if you go into a brain surgical unit, a neurological rehab, you are going to see evidence of everything I'm about to tell you. However, if you look at the imaging studies of people's brains when they do functional MRI scanners, it doesn't hold up to scrutiny. And so a lot of people who say, well, the brain only ever works as an integrated whole and you don't have a dichotomy of function, they're reading on the more theoretical models as opposed to practical application that you'll see in people with brain injuries. Left brain is largely the conscious stuff, as I said before. In NLP terms, it's the content. It's content. Basically, it's the story of your experience. And it's all the history and everything else. The NLPers and alphabet therapists generally love to dismiss content as irrelevant. Really? If you're doing that, if you think, oh, I only work with process because I'm a well-trained alphabet therapist, you may want to reevaluate some of the things you've learned to be true and actually look at the reasons why. Just saying. Content is not something to be utterly dismissed because it's irrelevant to change work processes. Absolute nonsense. Meanwhile, over on the right, the right side, let me just label this. So we got left and right. Over on the right side, we have all the submodalities. If we were to put that in different terminologies, the left hemisphere is the digital hemisphere. And the right hemisphere is the analogical. So this is basically content over form. Now, information from the right hemisphere gets sent through the corpus callosum for processing over in the left. Meanwhile, information from the left hemisphere gets sent through the corpus callosum for integration to the right. Now, if we cut that, and information can't go across, that's going to be a problem to each hemisphere because it has to find its correlation. Allow me to give you an example of what an experience from the right hemisphere that does not have correlation. Let me give you an idea of what that would look like. Deja vu. Now, most people have had deja vu, and it's a really, really weird experience. What we know is that people on the downward phase of a depressive breakdown, so before in what's called prodromal, in the prodromal phase of their breakdown, where they don't yet know what's happening to them, things are going wrong in their lives, and they haven't quite caught up with the fact that they're slowly going mad. They may well have an excess of deja vu type experiences. This is the right hemisphere generating experiences that don't have a correlation with content over on the left side, which is why you have this sense of overwhelming experience of familiarity, but there's no content within the experience. And people think, oh, it's a mystical. No, it's not. It's just a brain thing. What's something on the left side that has no correlation on the right is when you talk to yourself. It's trying to find correlation. It's trying to find integration. It's trying to find its corresponding part. You have a problem with a parent. About half the world seems to have problematic parents, and you find yourself having those. You got the phone call, the weekend phone call. You haven't phoned them for a while now. The guilt's setting in. You better give them a phone, and before you call them, you're running the story in your head. You probably run the story in your head anyway of the sort of conversations, the double binds, the hopelessness of it, the helplessness to actually influence, try and get them to see sense and be rational with you, and they can't. And you have those conversations in your head. Why? Why are you having those conversations in your head? What's going on here? You're trying to find integration. This is you trying to find an out, trying to find completion, cycling around variables that are available to you in order to try and get resolution. And that way, whatever the story is here, it latches on or connects to its correlating thing over here, and they match, and now we have integration between the two things. It's done now. We don't have to keep cycling it through. Sometimes you will not be able to do that in consciousness. You have to do it in dreams. And that's why dreams can have one of two functions. They can create integration and resolution for you. And you think, oh my God, I feel so much better for that. Or they can completely wreck your day and you have a nightmare that leaves you unsettled for weeks. That's the opposite. Actually, what's happened is something's been generated. It doesn't have a correlation and it's still free floating until it can find something. There's other things as well. You see, sometimes you wake up in a bit of a mood, nothing much, nothing significant. You detect you didn't wake up too refreshed this morning, and there's a few things may not have cleared the metabolites from your synapses through the sleep function. And before you know it, you're having an argument with your sister in your imagination about something she's done recently or said recently, and you're running the story through and you get really angry about stuff. And then there's something on the news that gets you irritated. You go to the supermarket and people are rude in the way they behave with their shopping cart or in the car park. And you get irritated with those things and you're finding things to be justifiably angry. That's when the right hemisphere has got something going on already and it needs to find the story. It needs to find an explanation it can integrate with. One of the problems about alphabet therapists, especially from the hypnotherapy backdrop, is this notion that everything is fixed when we regress to cause. If you're somebody who believes regression to cause is the way to fix things, please stop. Please stop. It can be a way to fix some things. It's not going to be a way to fix everything. You see, sometimes there is no content that's the cause. The mood comes first and it finds content. You know the angry, we've all worked with the angry guy. The guy you have to walk on eggshells around because you know, but sooner or later, you're going to do something absolutely trivial that's going to make them fly off the handles. That may have been a parent. It may be a spouse. It may be a colleague, but they're everywhere. These are people that are already angry. They're looking for the reason to attach it to. This is something from the right hemisphere looking for a story. Now, what can happen is that when we start inventing the stories, the conversations with whoever it is we're having the argument with in our imagination, we're now in a recursive relationship where one is reinforcing the other. The impossibility of the argument that we're having makes us more irritable and more angry, thus reinforcing the biology that drives it, generating more of the stories. So round and round it goes. It's a recursive thing. Or we might be the thug in the pub who looks for a guy to go and smack in the face and win, and we feel better. That's another way these things are done. And some people not necessarily smack people in the face, but they're looking for weird manipulations inside their friendships, inside their relationships with people to bring a conclusion to the story they're the one running in their head. If anyone's been in a relationship with a narcissist, you will know exactly what I'm referring to here. These things can go quite extreme, where the person requires another person to be an active party to their fantasy inside their imagination. So not everything can be communicated across to the other hemisphere in a way that finds integration or finds resolution. So the brain has to do something else. And what it will do is it will send an analogical signal from, say, the right hemisphere into the body. But in order for it to be received and integrated, the analogical signal needs to be converted to a digital signal. So the body acts as the integrative function. Much like the corpus callosum will convert the signal into a thing that the other hemisphere can understand. Now what we have is a digital signal coming back. Meanwhile, what we have is digital content coming down here to the body, which gets sent back as an analogical thing that the brain can understand, or not, as the case may be. Now, what do these things look like? I can tell you what they look like. They look like symptoms. Symptoms that people present to a therapist to be therapized away. And sometimes they will be swished away, tapped away, eye movement away, everything away. Basically, symptom suppression is key, but it's not doing anything with the imbalancing of communication between the two hemispheres. There is no integrative function. There is merely repression and suppression that's being enacted. If you want to see the consequence of that, look how many people there are in personal development who go nuts. They end up thinking they're some kind of religious, spiritual prophet. They become completely narcissistic, or they just go insane. They lose their family, they lose their jobs, they lose everything. And they keep saying, I'm fine. It's just that I'm doing better than those people. And there's this disconnect from reality that so many people go into. You can see why that's happening. They are merely symptom suppressing rather than integration to become a whole. They're actually creating more of a falsity for themselves. So this is where we get things like psoriasis. We get a stress rash, the stomach ache, the mysterious malady, the chronic fatigue, those symptoms that defy all medical causation. And there's lots, and usually after a while, people give up with their doctors because they're like not going to get anywhere with their doctors. So they have no choice but to start looking at alternative therapies. And what they'll find is other explanations in using all diagnostics in medicine is a metaphor, all diagnosis is a metaphor. They're not going to find a relevant metaphor within medicine. So they'll go to the alternative communities to try and find an explanatory model for why they have the symptoms that they have. And so this may well take the form of that horrible feeling you have in the center of your chest, the heaviness. It may be kinesthetic, it may be somatic, it might be a twitch, it might be a stutter. It might be all sorts of different things that are actually largely being driven by the body trying to, or the brain trying to communicate something to the other hemisphere because the other hemisphere ain't getting it. And the body's inability to convert that to a meaningful signal. Now, what we can do with that is, with IEMT, of course, we can take those symptoms and, oh God, regress it to cause. We can regress it to not the trigger. And this is a mistake. People think of the kinesthetic pattern in IEMT as regression to cause. It's not. It's not regression to trigger. It's regression to, when did this start? What was the experience the person was having where a disintegration or non-integration took place that has been leaving them now forevermore with this set of symptoms that they've been seeking for help with? And that's why the IEMT model is so effective in dealing with some people where you have lifelong maladies the person has, and in one session, I haven't got the maladies anymore. And people are completely baffled as to how it doesn't happen all the time, but when it happens, it's unmistakable. I think, what's going on? How have I been able to have all these other medical treatments and everything else, and a bit of eye wriggling, and suddenly everything's fine? It's less about the eye wiggling, and it's more about the structure of the kinesthetic pattern. Now, when we look at identity and the disintegration or non-integration of identity, we're doing exactly the same thing, because a lot of stuff is going wrong at the identity level. And the two hemispheres don't agree on who they are. They may well be at different emotional ages and all sorts of other things as well. And so we need to balance those two things out. So I think that's all. Any questions? I ran through that one a bit quicker than I was planning. Right, over to you guys. Anyone got any additional things, any questions? I can see there's some things in the chat.
Yeah, just talking to myself on mute there. Guys, if you have any questions, if you want to raise your hand as well, then I'll come and yep, Robert, that was swift, but now let's sort of discuss. Right, he's got some stuff. Kim.
Hi, hello. Can you hear me?
We can.
Loud and clear, Kim.
Oh, that's lovely. Thank you. I was wondering, you said about the two bits coming down to a cause. So would something like a migraine be a part of a symptom as well?
Now, what I'm going to put is this. I presented this the other day on a training, and I was challenged by one of the medical people. Basically, am I saying that all symptoms are a result of this?
No, but I think this is a good pattern to one of my clients that gets migraines, right. And I think she's self-punishing or doing something, and she won't let go of them either. So this really does fit what she's doing.
Yeah, I suspect for some people, you're not, I potentially, with someone who's got simple migraines where that's confirmed by diagnosis, medical diagnosis, it's worth a try. I don't think we're going to, and migraines are the complete enigma. No one, I mean, Oliver Sacks wrote a book on migraine because he was a neurologist of a considerable repute, who wrote loads of books. He discovered the treatment of the film Awakenings was made about him. Great guy. He also was a lifelong migraine sufferer. And he basically spent his entire life, working life, trying to understand what is migraine. How does the brain even get pain? Because it doesn't have pain receptors. So it is a great medical mystery. It's worth a try. I would say it is worth a try.
I'm thinking of that, and this is the first time that an explanation to use IEMT in this way that you're describing would actually work for her, because she's even tried changing her diet, her whole lifestyle. No matter what she tries, she punishes herself more.
Yeah. It's worth exploring with this sort of thing.
Thank you very much. That's very kind.
Thanks, Kim. Ronnie, how are you doing, my friend? He's got a question as well.
Hey, Matt. Hey, Andy. Question. When one of the trainings I attended with you, you mentioned that you had an experience that happened, and then you went back to a retrospective thing, guilt relating you doing something with somebody that was not related to the accident that happened. So is there a pattern of how we go to specific points in time due to a currently experienced emotion?
Let me explain what you've just said there to everyone else that wasn't present for the conversation we'd had. Okay, so kind of very long story short, I was in an event, a slightly stressful event. I was in the back of a taxi with my wife on a mountain road in Turkey late at night, and the driver was going too quick, and basically our taxi left the mountainside and went free fall off the side of the mountain. A little bit of a stressful event, as you can imagine. Anyway, we got out alive, mostly. And when we eventually got back home, following discharge from the hospital, I had recognized that I'd had a few post-trauma stress symptoms beginning to emerge. It took a little while for things to start to emerge. I was in the bath, and a few things started to go through my mind, and I had some horrendous shame, guilt, regret relating to a child at school called Philip, who we'd all picked on, and I'd picked on him too. We'd all joined in picking on Philip, whereas actually I should have not picked on Philip and potentially, told everyone else to not pick on him. But I joined in. I was only a little kid. And what fascinated me was that I had no shame, regret, or anything about the accident, but I was clearly post-trauma in shame and regret. But it wasn't about the accident. It took me back to something I'd never thought about in my life. And so essentially doing a bit of work on that, it hadn't occurred to me before then that when people have the shame hangover, the regret hangover following trauma, that actually it doesn't necessarily go back to the trauma. It can go somewhere else. It had never occurred to me because I never experienced it. Now, so how do we target it? We don't. We simply stick with the kinesthetic pattern questions. And when's the first time you can remember? It doesn't matter where it goes to. Because essentially the reason the person can regenerate that stuff is because of the lack of integration that occurred much, much earlier on. That would be my hypothesis here. So it doesn't matter. I don't know if that helps.
So there's no like specific things like trauma gets somebody to go retrospective, or like currently experienced shame gets people to go prospectively. There's no pattern.
I tried. No, in the early days, I experimented an awful lot. This was back in the 90s. I experimented an awful lot with time directions. What I had done, I used to live in a basement flat in the center of Southampton, opposite the psychiatric unit in Southampton. I was working at the other hospital in Southampton, but I lived opposite the smaller regional hospital, which had the psychiatric unit. I used to go over there for lunch because basically staff card, get cheap food. And it would save me cooking. So that was I got to know an awful lot of people at the hospital. I also did agency work periodically, mostly on the surgical unit in the evenings. As a result, I got to know some of the psychiatric staff, and I got access to various clinics. I asked to be admitted as a patient, a non-treated patient, to the secure unit for 2 weeks. I wanted to live in the secure unit for 2 weeks amongst the patient groups to basically learn what I could learn. They wouldn't let me. They let me go for 2 weeks every day. I could stay there all day. They wouldn't let me stay overnight, which is what I really wanted to do. I would basically immerse myself into the patient population. They wouldn't let me do that. As a result of those kind of activities that I was doing, I got access to the EMDR clinic where I was watching EMDR be done. And I was fascinated by how some people, a few eye movements and they're done. It was amazing. And then others who were on their 6th or 7th session, plenty of eye movements, 6 or 7 sessions in, nothing is happening. So I started experimenting with the variables, and not there with people I was seeing. And one of the things I started to look at, does eye movements work on anticipated event? And consistently, it didn't. And I thought, okay, is this one of the issues and why it's not working with some of these patients I'm seeing at the clinic? That their problems are anticipatory, and that's where their focus is going. So what I wanted to do was then develop a way that, okay, so if an anticipated event is still an event that's recreated, because I'm the one creating it in my mind, and I have to base it on past events. And that's where the beginnings of the kinesthetic pattern, and when is the first time you can remember feeling this? It doesn't matter whether it's anticipated if feeling or not, we're always going back in time. And that improved outcome tremendously for people. The other thing was the angles. They were only doing left and right eye movements, and I think that was the other factor. So it doesn't matter for our purposes of using IEMT, it doesn't matter about the time orientation of the problem the person has. However, I always have to say this: IEMT is not the therapy that fixes everything. It's incredibly useful some of the time for some of the people. And it would be foolish to think this is the cure-all for everything. It's just a very useful tool set.
Thanks, Andy. Thanks for hosting this, Matt.
Yeah, just on to add something to myself, really. When I'm working with people, and especially when I'm doing the trainings, people are trying to keep the sort of the regression to within the context of the problem. So say it's about public speaking, or being in a meeting at work, they're trying to think about the first time about having this problem within a meeting. And I'm like, no, it's the first time. The context isn't important. Just follow the feeling back to the first time when you can remember feeling this way. And you often go back to incredibly early things, obviously at school or seeing something happen at school. So when you're working with clients, make sure that when they go back, it's not within the context. It's just you take the feeling to the earliest time possible. We have a question from Alan.
Yeah, Andy. So the people that are talking to themselves within their brain, you may have answered this. I just not to get it right myself before I have a conversation with myself. You would take them back to the first time they can recall having conversations with themselves.
No. That's it. No, I wouldn't be doing that at all. What I'm saying is that as when people are having those conversations with themselves, that's what's going on here. Right. You may want to be looking at other factors within that whole experience to do the IEMT on. Can I just give a distinction for people that you may have never thought of as well, just using Alan's terminology? So you have a conversation with yourself, and you have feelings. Well, if you're having a conversation with yourself, I'm going to put to you, you have feelings with yourself too. That the feeling, so you have conversation from one hemisphere to another, but the reply is kinesthetic. Or it's not necessarily a reply, it could be actually a feed forward. Feelings are your brain talking in feelings to the other brain. And it's a completely different way of thinking about the kinesthetic components of your experience. These are feelings that are being communicated back to yourself. That then people go, I don't like this feeling, I'm going to ignore it, I'm going to shelve it, I'm going to put it away, I'm going to get some therapy, I'll get some medication, I can make all that go away. What? All you're doing is basically suppressing the right hemisphere. You might want to find out. Now, there's loads and loads of therapeutic models that pre-exist my work, which is basically talk to the symptom. This has been done through hypnotherapy, through things like Louise L. Hay. You've got New German Medicine. There's lots of models that have this kind of thing to varying degrees of efficacy, which is essentially what is the symptom trying to communicate? Or, more importantly, what is the symptom communicating? What is that communication of the symptom? And we work with that level. The difficulty with some of those models is that the person doesn't always have access to that data. And often it's a projection from the therapist who then decides what it's communicating. Oh, when you have a shoulder pain, it's because you're shouldering the world's problem. When you've got a cough, it's because there's something you want to get off your chest. No. That's the therapist projecting their nonsense onto the client's symptomology. We'd have to actually get that information from the client. The easiest way to get that information if you're using traditional methods is using trance and hypnosis, because basically you're then getting the left brain to shut up. That's what hypnosis is. You're basically, left brain, can you please go away? I'm talking to this brain over here. That's what a trance is. And that's why people go very quiet in trance. And that's where you can then get better quality access to the right hemisphere. I don't know if that helped, Alan. I don't know if you even answered the question.
Yeah. Do you know what? I'm not sure. So I'll have to.
I think
let's move on quickly.
From that, before we get on to Phil. Yeah, so basically, when people talk to themselves, their experiences the feeling, I would then use the kinesthetic pattern on the feelings that are then generated or experienced. That's personally what I would do.
I'm just wondering because, so like for myself, and I don't want to make it about me, but I have constant conversations with myself. So that could actually be the problem.
Yeah. You want to knock it off, Alan?
I do want to knock it off, but that's later. Thank you.
I chat to myself all the time, but I find myself interested.
It all depends. Okay. It does depend on the quality of the internal conversation that you're having. Oh, and by the way, I just see what Ronnie just posted there. Please don't send me the Bob Newhart "Stop It" video. Okay, I get sent that every sodding week. As people discover it, and go, oh, that's one for. I know, I've seen it. I've seen it before. You don't need to send it to me. So thank you for that, Ronnie. Just to put a stop to Ronnie's little suggestion there. I see what you're doing.
Phil, you have a question. I did send it on to Andy as well, so we have seen it. But if you want to ask it now, I think it'll be clearer if you do so. So Phil, take it away.
Thank you. Hi, I'm Phil, core transformation coach in Canada.
Hi, Phil.
Hi, I've got really interested in the gut brain, heart brain findings. I'm wondering, I'm sure you've got interested as well, but whether you've found out anything more about it. I'm just, from what you've said, I'm just wondering if they essentially communicate through the right hemisphere.
No.
No. Or being seats of feelings, and the gut seems to be a seat of identity. I just wonder how
they would that communication will go to both hemispheres equally. Right. But the quality of the information gets interpreted differently, whether it's an analogical or digital interpretation. Okay. Just as a quick aside, I'm currently working on with a colleague. We're working on a new module for IEMT on somatic therapies. Cut a very long story short, IEMT is going to be classified as a somatic therapy as opposed to psychotherapy, simply because there's more and more data being published. We've got a number of people doing various write-ups and bits and pieces. We've got more medical people involved, so we have to now categorize it correctly, and so it's going to be a somatic therapy. Within that, we're now looking at doing something around the brain-gut interaction. I currently have a neurologist writing the manual for us. We've got the data together, so we will be rolling this out in potentially October or November of this year, looking at the mind-brain interaction and where IEMT fits in with that. It's largely built on the observation of what IEMT is doing for psoriasis. Now, in terms of how we've got two things in the gut. You've got the human biome, which is all of the different bacteria, of which there's several thousand different types. I've not catalogued them all yet, and the effect those bacteria have within the gut. Essentially, what they do is they produce all your neurotransmitters. People think neurotransmitters are generated in the brain. They're not. They're generated in your intestines by bacteria. When you screw up those bacteria, you can really screw up people's personalities. Now, I got myself in a bit of trouble a few weeks ago on Reddit because I posted. People may know I've got ongoing abdominal issues. I went to Slovakia earlier this year to a hospital clinic there where I had a fecal microbiota transplant, a poo transplant, where essentially they take bacteria cultures from 10 super healthy subjects and basically stick them in the patient. That patient in that time was me, to try and correct some of the imbalances. Now, the observations from fecal microbiota transplant, it's been around for a long time, is that there are a good percentage of people with autism who, following that process, are no longer autistic. There's also now microbiome treatment for depression and anxiety, where they actually put in very specific bacteria. You can buy this stuff on Amazon. the different types of probiotics, it doesn't work so well as an oral thing because it doesn't, not very little gets past the gut, but past the stomach acid. So they actually put it up the other way. And again, there are there's a huge amount of data of people that are having their anxiety and depression cured through nothing else than bacteria being added into their gut, because they're actually they're starting to catalog specific bacteria and specific effects. So that's one aspect of the gut. The other one is the sheer mass of nervous tissue. And so essentially you have as much many neurons and brain matter in the abdomen as you do in your skull, hence why it's called the second brain. Now the communication between this brain and the second brain is very poorly understood. The data is quite conflicting and the models are still developing. We don't have the data yet. The day that we're able to go full Star Trek, and when you feel something, it can be detected on a scanner. I absolutely believe that one day that technology is going to exist when you will be able to do an imaging scan of a whole body, and you'll be able to see emotions happening in the body as they happen. That technology is going to happen in our lifetimes. I'm certain of it. It's just they haven't quite got what those frequency changes are in amongst all the other frequencies going on too. I don't think that answers your question at all. But in summary, I don't know. Does that help?
Not sure what my question was, to be honest. I'm just throwing out interesting ideas. I actually sent a slightly different one to Matt ahead of this. Maybe you've already answered. I don't know. I was curious that when we look at the identity integration, that I tends to be in the head area, and me tends to be in the heart area, and myself body. And I often find, well, gut is often what people call body is often gut body, you know. And I thought, well, that's interesting. Maybe there's parts conflict goes further than two hemispheres, but heart wants one thing,
I'd be certain
head
of it.
wants another, etc. And so we've got like 3 areas. Anyway, I'm not sure if that has much practical implication.
No, I think
IEMT
you're absolutely correct, because one of the problems we have in terms of our existing models of understanding of how brain gut interaction works is basically the gut is passive response to brain stimulus. And so things go wrong in the body, or things go wrong in us when we're doing all these stress things inside our head, and it upsets and affects the abdomen. It's only ever seen as a one-way street. But of course, with the biome research that's going on, we actually know very well it's a two-way street, and that there are some things that are actually initiated in the gut and is not beginning in the brain at all. And actually, so doing all the psychotherapy on the brain is not going to help. Enter the work of Robert Scaer, S-C-A-E-R, who we have contacted this week because we're basically going to try and get him involved in the project that we're working on. And he develops a body of work around what's called the psoas muscle, P-S-O-A-S, psoas muscle. Now, there's a particular problem in the alphabet therapy scene with this model, which is essentially trauma causes muscular tension. And it seems to be that the psoas muscle is a big sheet of muscle central to the body that holds the upper half of the body to the lower half of the body. It enables you to do sit-ups. And the suggestion is, and there's a lot of now data to support this, that when you have a protracted tension in the psoas muscle, you're going to have symptoms of PTSD or post-trauma or complex trauma events. So essentially what Scaer came up with was a number of exercises to stimulate a shaking response, which is observed in all animals who are basically predated upon. And when that is triggered, people are relieved of the somatic symptoms of trauma, and it works extremely well. In some people, some of the time. The problem with that body of work is the people then create training courses and set up institutes and do all this kind of stuff as it's the grand unified theory, where they do all this stuff around the psoas muscle, because that explains absolutely everything. And of course, as a result of that, like all therapies, now the actual data is really muddied by all the fake claims, and they believe the claims they're making, but they're not actually substantiated by data, where now it's really hard to actually ascertain what really is effective and what isn't. And I'm seeing some quite disturbing videos appear online of manipulation of the psoas muscle which involves an awful lot of hands on the pretty lady, manipulating in nether regions and all sorts. I'll say that for another day. And I'm not convinced actually they are following Skeier's research. They're more sort of coming up with their own innovative approach, and that's
Cool.
that's a legitimate somatic therapy in the original true model.
Cool, thanks, Phil. I actually saw or on a podcast or something recently that when you see a famous person, that sort of desire to try and touch them, they think it's something to do with the microbiome. You're trying to get some success by literally touching somebody. Sally, you have a question.
Hello. Hi. Hello. What you were saying earlier made complete sense to me, because I woke up in a bad mood this morning, and the first email I read from my boss, like, really went, whoa. It's like, and so I just realized that when you said that. So that I think that is sometimes true, and I'm going through a bit of a bad patch at the moment. But so it's nothing to do with what he said. It's about everything else that's going on in my life. I just wanted a question about the stuff that you're going on to now. Does that mean like EMDR is like sort of accepted by the NHS or medical profession? Is that what you're going to take IEMT in that sort of?
That's exactly where we're going with this.
Yeah.
We would have it by now if people actually did all the things they said they were going to do. I've got let me have a little gripe. One of my particular gripes is that I'm constantly approached by people who tell me they're going to do stuff and they're going to help on this particular project. It's too big for me to do on my own. I simply can't do it. I've got to earn a living as well as try and do other stuff. And I'm constantly approached by people who tell me they're going to do this and do that and do that. And then they never actually do it.
Yeah.
And I would say 90% of people that approach me telling me they're going to do stuff, I automatically know I'm never going to hear from them again. I'll chase them, and they always tell me they're just about to do it. They're just about to, and they never do. So essentially, if I can get more people to actually participate, it would be amazing, and we could actually get this done quite quickly. So essentially, what we're doing is going through a process of getting academic acceptance to what we're doing, and then getting legitimate university level accreditation. I'm not really interested in getting accreditation through things like the psychotherapy bodies that everyone just sets up. We're going down that particular route for sure.
That's great. That's good news, because I just think it should be. It's I just love using it, and it's.
A number of years ago, quick sad story for it. A number of years ago, I got approached by a government body in the US. They wanted to they had a huge sum of money. They said, we would like you to come over here. There's actually a prison service. We'd like you to come over here, and we will set up some clinical trials because we think we can use your work in our rehabilitation program. And the sum of money, and we have an fMRI scanner. Whoa, I'm in. I'll book my ticket. And then a few weeks later, Obama got elected. And one of the first things Obama did was slash the budgets to things like the prison services. And that budget was gone. We were that close. So we nearly got there, but it was gone.
Guys, if you want to hear more about sort of the NHS sort of side of things, I've recently done some interviews on my YouTube channel, which is just youtube.com/IMT practitioner. And they are mental health nurses. And basically, they've been trying to integrate they can't do the eye movements, excuse me, but they have been able to do some of the other things around IEMT. And some of them are actually going to open their own private practice so they can do the eye movements, because they've seen just how effective they are. And rather than having to do like 12 or 16 sessions, they can probably get to the same sort of resolutions within probably sort of 2 or 3. So they are actually going to be offering private sessions as well.
Can I just throw something else out there on just on the end of that? We have a neurological doctor, and we also have a chief psychiatrist who will co-write any research paper or case study that you want to get published. So if you have an interesting example, and you still need access to the client, you still need to be able to do a follow-up with them according to what the criteria is going to be. We have 2 basically senior clinicians who will co-write the paper with you and get you into the academic literature. And all you've got to do is just message me and I will connect you to them. But it does mean you've got to do the work. to hold on to the idea, to have a dream that one day you get round to doing it. Please don't. Basically, just do it. You'll be amazed at the impact it has on your business. Just saying.
Robert, do you actually just want to come on? Because Robert's somebody who actually does sort of physical body work and uses IEMT as well. Do you just want to come on because you put some quite good comments here as well?
Yeah, no, just adding to what Andy said. It makes total sense, and yeah, it's fantastic. It's very exciting to realise that IEMT is also going to start developing as a modality, incorporating that understanding about the body and how the gut is. Yeah, I'm very excited about it. I was just adding a little bit of information from my own background.
Because you do Bowen therapy, isn't it? If that's correct.
Yeah, I do, but because I've been working with as you know, I trained in hypnotherapy and the various other modalities over the years. There's always been this crossover in terms of the emotional somatic patterns and trying to understand what they are and what they mean. And so yeah, I mean, I'm always looking at this. I'm always seeing this pattern in the gut, and looking at the fascia that envelops the organs of the intestine, and then its proximity to the psoas and the tonicity of that whole area seems to be so key to these clients feeling better. And it also explains why targeted visceral manipulative soft tissue work will very often help those clients who have these deep traumatic wounds feel better without ever doing any talking.
Right, good work. Good work.
So it all fits in with what Andy's saying.
And there's a correlation as well with I'm completely unfamiliar with Bowen therapy, so do forgive my ignorance.
Oh, sure. No
Wilhelm Reich with Reichian therapy and what they called Rolfing. Now, Wilhelm Reich was quite a high-level academic psychologist who then discovered that there's orgone energy that you could accumulate in orgone accumulators and cloud busting and all the rest of it. If those familiar with the Kate Bush song "Cloud Busting" and the video, that's about Wilhelm Reich. And then that's the point where academic psychology, well, I think we'll depart from this. But he did a whole thing around the fascia, which is the very, very tough membrane around each muscle, and manipulation of the fascia to release trauma. I had a one Rolfing session. I think you normally have about 10 or 11 or something like that. And I was astonished that, well, fucking painful for a start. I mean, that was the thing. It was like, my God. But whilst I was being Rolfed, the images that were flashing into my mind, it reminded me of the studies by Penfeld, who basically took the tops of people's heads and stimulated the brain with electrodes to map out the brain. And when certain bits were touched with the electrode, the person had a memory that was so real they were there. They were absolutely there. That was the experience I had. Flashes, they were only flashes, but it was extraordinary, and it was like I was teleporting to an alternate reality just for moments at a time. I can't say it improved my life, but then I only had the one session, and I was too busy screaming and moaning. Painful.
We are just past the hour mark now, but does anybody have any final questions? Oh, Benita's just coming in as well. Does anybody have any final questions at all for Andy in regards to this or IEMT? Oh, Stephen, you'd like to go.
Oh, hi, Andy.
Hi, Stephen.
Just one question, maybe just how you'd put this in your words, but would you say that IEMT is kind of like taking identity is kind of like exteroception, i.e. the senses of hallucinating your sight, your smell, your hearing of the world with feelings, i.e. in the body, and whereas metaphors and movement is more proprioception and action. So I'm just wondering would you say that when you're hallucinating identity, you're basically, it's not in the brain, it's basically through your sensorial.
Yeah, it's a weird one. It's a really weird effect. I don't know if you remember being a child. See, a lot of people have memories of childhood. They're always dissociated. I can actually remember being a child. And essentially, there's no boundary between you and others. Children tend to move as an amorphous mass psychologically. And it's a really weird effect. Individuation and differentiation of identity, especially when you're young, doesn't exist. Your parents are your feelings. Your feelings are your parents. There is no individuation between the two. And as time goes on, we learn to individuate. Now, as we individuate, not everyone does, of course. If anyone who's in the middle of a depressive breakdown will know it's very hard to differentiate between, am I feeling this, or is it because of my father and how he's behaving towards me? Because you're running the story in your head of how your father is and your father's feelings, or whoever it is. And actually, that's your feelings running that. But your experience is there's no individuation from the other person's identity. So largely what I'm trying to do with IEMT is individuation of identity. That's largely what I'm trying to achieve. With the metaphors of movement work, we're largely looking at how identities interact with each other. That's that. If I were to try and reduce it down to its the minimal denominators, that would be the primary difference. But what is identity? How do we even know what and who we are? There are so many factors. It is so variable. And it's why I find the whole woke identity politics era that we seem to be going through so tragic and so excruciating to listen to these idiots talking about it, because they have reduced identity basically down to some tiny factors, and there's so much more going on than that, and it disturbs me immensely what's taking place. Again, I don't know if that helps or answers the question.
Yeah, no, that helps. And would you say that if you start to say, you go, oh my God, Dad, or oh my God, X name, when you have a stress or something, you're kind of mixing up your feelings with thinking about that person, you're starting to make that you or me or something like that?
An easy extreme for this would be looking at, say, religious zealots who now are feeling what God feels and they're communicating what God communicates. They have externalized identity, but they haven't given it a physical form that's tangible to anybody else. And so they're now free to invent and conjecture as much as they want to. And of course, that then goes with the sense of grandiosity. So then that starts to take over their identity components. Yeah, it's complex.
Cool,
identity is a really complex area.
All right, thanks, Andy.
Just stick to I, me, self, you, my guys. Yeah. Right, okay. Any other questions before we let Andy back out into the wild? Any other questions? Thank you there, Stephen. Let me just... any other questions at all? Oh, Sarah? I think it's Sarah.
Yeah, hi, Andy.
Hi.
Hello.
Hi. I've been playing around mainly in my own head, but I've tested it with a couple of clients around having I and me on columns. I watched one of your videos on columns and was fascinated with that. And looking at self-esteem, which is one of the areas that I want to focus on, when we put I and me on columns and we start moving them up and down, it fascinates me because I beats up me. Me is more important than I, and narcissism starts coming in some ways in that. And have you ever thought about it in that way?
No.
if
I give it the quickest, simplest answer, nope, never thought about it.
But actually, when I start to play with it, and I start to play with it with clients and say, well, where is I and where is me in terms of if you put them outside of yourself and where are they positionally? And they start to move them around. If we try to balance them out, usually one is higher than the other. And if we try to balance them out, they get quite a lot of relief from that. And I just, it works for me as well, having a self-esteem issue for the rest of my life.
There's two similar they would probably murder me if they heard me say this. Two similar approaches to what you've just put there. They're not at all. Look at what David Grove was doing with the pronouns. The I, me, self, and you, I got that from David Grove. I attended one of his events shortly before he died. And it was just really frustrating to me. I got to meet the man and then keeled over a little while later. And the whole weekend, it was 2 days of just looking at I, me, self, and you, and how they interact with each other and all the rest of it. So that's one to look at. And the other one, if you're not familiar with Lucas Dirks and his work around identity, you must. Lucas Dirks, D-E-R-K-S. He's a Dutch social psychologist. He's also an NLP trainer and just basically one of the smartest people I've ever met in my life.
This is a book.
There they go. Social panoramas. Now, what I keep putting to Lucas, that he ought to do hang out with Lucas weekends. I learned so much just osmotically by just going and staying in his house. You don't have to do anything, just hang out with Lucas. It's just his unusual and unique way of looking at the world is quite remarkable. He maps out all sorts of things around human experience and identity. We both heard of each other for a long time before we ever met. I had people coming to my courses go, have you heard of Lucas? Because you might want to talk to him about some of the stuff that you're doing. Meanwhile, Lucas was having people go on his course. Have you seen Austin? You might. And so eventually we met over at a conference in the States where we were both presenting. We were co-presenters. And then we've been collaborating ever since. So he's another one to look at. He's got a few books out now. But if you get a chance to go and meet with him, I say just hang out with Lucas Day. Because he explores things in kind of the similar way to how you're talking.
Can I just add into that, Andrew, that Sonia's doing an IEMT party at some point, I think in a few weeks' time, where she's actually going to have Lucas as her
Oh, fantastic.
guest. So that'll be something, if anybody's interested in following this a little bit more, get in touch with Sonia and she'll be able to hopefully add you into that.
Be sure to attend that one. Yeah, attend that one. That's going to be good. Yeah, you've got Sonia and you've got Lucas together. There you go. We can't go wrong. So yeah, do that.
There you go.
Yeah, I've just put a link there as well to Identity Panoramas. That's one of your online products, which goes, if you are interested in the identity side of IEMT, it's well worth checking out. Do we have any final questions at all before we both go into the night?
One more. Can I just ask, Andy, when you're going to be doing one of these again? Because as somebody who's been getting more and more involved, and obviously a practitioner now of both IEMT and metaphysical movement, just listening to you talking about things and just going off in different diverse directions is one of the most fascinating things that I think any of us experience. And thank you so much for doing it. But are you able to kind of like, very cheeky, do these more regularly so we can just all kind of dip in? I mean, that would be amazing.
Do check out my YouTube channel, especially the membership section. Cost you $1.99 a month for some amazing content. Absolutely amazing. Sorry, just quick plug. The membership section is largely training content. And they're much longer videos because no one's going to watch them on YouTube. So they're more for people who've got interest. But yeah, talk to Matt. I'm sure we can do this again.
Yeah, we will get these set up. I'm going to be doing a lot more interviews like this. So basically, I'm going to be creating like a bit of a, not membership site, but basically I'm going to be putting interviews together with all different kind of therapy trainers. So not just IEMT, but all different therapy trainers in general. Just because it's good lead gen for my trainings, to be honest. But I like doing interviews. I like actually learning from different perspectives as well. But this is going to be something which I'm going to be doing a lot more of. Guys who have been through my training, the next supervision session is in, I think it's a week or two. I don't know if it's next week. You'll have all the links. I will send it out to you again as well. Andy, do you have any metaphors of movement trainings coming up at all?
I do. I've got a level 3 coming up at the end of May. Metaphorestraining.com. That's metaphorestraining.com. However, if you haven't done the level 1 and 2, I'm sorry, it's not the level 3. It's the masterclass. You'd need to have done levels 1 and 2 in order to attend it. Otherwise, it will make no sense whatsoever. There will be new dates put up for later on in the year.
Cool.
The only reason they're not there is my health is not particularly great, and so I'm kind of been holding off putting up things further in the future because I've been cancelling so many things in the last couple of years. I'll just hold off for a bit before I book anything new. But there will be dates going up soon. Hopefully this week, if not next week.
Brilliant. Guys, I think we are done. Andy, thank you so much.
Thank you so much for having me.
Yeah, no, it's been really, really great. So guys, thank you so much. This obviously is on YouTube. I'll actually send out a link to you again as well. Please do share this with people as well. If you think people are going to be interested in this, please do share it. You find the YouTube video and click on the like button. That's it. Like, share, steal, take it, whatever. And again, I'm going to be doing some IEMT trainings very soon. Again, I'm just waiting for some medical things to be confirmed as well. So I'm going to be doing weekend ones, also some during the week as well. And I am putting together a coaching product that involves IEMT, which will probably be a one-day training of basically how you can use a coaching model and how you can use all the IEMT skills within that. So it gives you more of a structure, a sort of, and it's going to be a longer, sort of usually about a 6-week kind of program that you do with clients. I'm going to be doing that as a one-day training at some point as well, and some more different kind of masterclasses. Or, you know, I'm not, I'm just going to sort of sit around, but you know, it'll be one of the two. So I will be doing that. So Andy, thank you very much. Hope you get well soon. Guys, thank you so much for attending, and I'm going to stay around for a little bit now. If anybody has any questions about IEMT, I'll do that. But Andy, I will
bid you good night. Thank you, everybody. I'll see you soon.
Thank you very much. See you later. Take care, Andy. Thank you very much. Cool. Cool. Well, that was great, wasn't it? So basically, when you're getting messages and symptoms and stuff from the body, use it through the IEMT, through the kinesthetics. You can also do some identity work around it as well. If you watch the interview I did with John about psoriasis, no, he didn't do it as an identity, but I know in like the advanced course to go more into the identity and the anthropomorphication of things like this as well, which is really interesting. So I sort of do it in sort of different ways. I don't work with pain because I'm not, you know, medically trained, so I kind of stay away from pain. However, if somebody has sort of aches and sort of weird things that kind of come up, and coughs as well, especially, I always regress back to when they can first remember being this way and having, and yeah, it has an amazing relief. So I might even do a masterclass day around that as well at some point. Does anybody have any questions about IEMT or training? Oh, I've got some people pinned on my, I'm not quite sure why it's pinning. Anybody got any questions?
Me please.
Yes, Sally, go.
I didn't realise you did supervision. I know you do the, like, on Facebook, when you were allowed on Facebook to do the lives things. Go on.
So when I say supervision, basically it's a monthly Zoom call for the people who've been through my course. You should be getting emails about it. If not,
no.
You should definitely message me afterwards, and I'll make sure. I don't know why that is. So basically, it's just I take all people's questions, and then I put people into practice rooms if they want to do any practice on things, and I'm there to watch if needed. So I don't know why you're not on the list. You definitely should be. So basically, it's all the people who've been through my training. So
okay, I'll message you after and just.
Cool.
Okay, thank you.
Perfect. Any other questions at all? You can ask about anything really. Ask about. Let me bring the gallery back in.
I just want to say I'm about to shoot off, but thanks again, Matt. It's always really, really good to kind of see you and have a very brief chat occasionally. I know. Kind of ends up a bit longer, and then one of us has to shoot off. But no, it's really cool to see you, and I think that we forget to keep in touch with each other enough.
Yeah, and this is why I'm trying to do these monthly things as well, and I will be making more of a community around IEMT. I've been dealing with basic recovery specialists, which essentially means sort of like hackers, to try and get back into my Facebook, but it looks like a lost cause. So I think I'm just going to start a new group. The business page has gone. That had 35 5-star reviews. Luckily, I have images of them all. But I'll be starting a new Facebook page. So if people don't know, my Facebook got hacked about 6 weeks ago, and I had 4,500 contacts, and my IEMT group has over 1,000 people. So it's been a fun time, but I think it's just something which I'm just going to have to rebuild. And apparently I should be on TikTok from what I've been told, but I'm not a 12-year-old Chinese girl, but I'm going to give it a crack. I know John Adkin.
Give it a go.
Yeah, John Adkin, if you know John Adkin, he does a lot of stuff on TikTok and does very well out of it as well. So check him.
I'm on TikTok. I don't do that much, but Freddie Jacquin has just joined TikTok, so I saw earlier on his Facebook. Yeah. So there are some hypnotherapists on there doing quite well.
Brilliant. Do you know what? Little top tip here: don't link your social media profiles together. because I have a TikTok account. Apparently, I went on and found it. I've got 250 followers. I don't have any content on it. I can't access it now because my Facebook's been banned. It's also banned my Instagram and quite a few of the services that I look. So never use your Facebook to log in to another service, basically.
I thought you'd been banned for misbehaving. I'm very disappointed now.
Oh, no, what happened was I started getting these emails saying your Facebook, your password request is basically did it. And I was like, what's going on? So I went onto my profile and it says your Facebook, your profile's been disabled due to 29 pictures, indecent images of children being posted to your profile. And I was like, oh no, that's really bad.
This is not good. This is not good.
And I had 150 notifications. So people obviously have seen these things and gone, Matt, what's going on? So I was going to get the police involved because Facebook, you can't contact Facebook.
No.
You just can't contact them.
It is a completely anonymous, faceless environment.
Yeah. And so they've even said, you've got 30 days to request a review. So I did. And after 30 days, they said, we're not reviewing it. And we haven't reviewed it and we're not going to review it. I was like, oh,
great, thanks.
Thanks for that.
Thanks for all of that. And we'll just start all over again. Twitter banned me because I was impersonating myself, which I thought was an interesting concept. I was impersonating myself.
I got banned from, disabled, restricted on Facebook because my sister's an artist and she does mosaics and she's done mannequins and stuff before for like hairdressers and fashion shops and stuff.
Oh yeah.
Across the road from where I used to live, there was a mannequin, like a female torso mannequin. There was silver, and I took a picture of it and I said, Sally, do you want me to get this for you? She goes, yeah, absolutely. So I got it and I had it in my flat for a while, which looked a bit weird. And she said, I'm not going to use it. So I thought, right, I'll just sell it on Facebook Marketplace. So I put a picture of this man, and it's quite obviously a mannequin. I put it on instant ban for trying to sell a sex doll.
Yeah, but it's you've got too much flesh colour on there. You see, one day you're going to get banned for being
silver.
yourself.
It was reflective.
You're going to have to start wearing a wig or a hat.
I can't believe that they weren't concerned with the fact that they didn't have a head or arms and things. Yeah. You know what I mean? That's what they picked up on.
Oh, you decapitated somebody and then tried to sell them on Facebook. Now that's a new concept. Hey. Anyway,
I'll see you later. Take care. Anybody have any other questions at all about IEMT or anything in general?
Can't think of anything at the moment, but if I do, I'll message you. But,
brilliant. And for those who are still on, how has it been going using IEMT with your clients and stuff as well? For those who use it with clients.
If I can get clients, very good. Great, but it's just tough. But I'm talking about, I did a face-to-face networking for the first time for ages a couple of weeks ago, and I've asked to do a demo and talk more about IEMT in terms of identity work. A couple of people have said they're interested, but they want to do skill swaps rather than pay. But
nice.
I talk about it every opportunity.
Brilliant. I've been.
I have a question.
Oh yeah, who's this?
It's Joanne. It's Joanne Del Santo.
Okay. It's just sorry, it's a bit of a bad line. Okay, go on.
Okay, so because I'm on my Bluetooth probably.
Oh, okay.
So if you can't hear me, just let me know. But I wanted to know when you're doing the identity imprint, if oh my God, my question went out. Hang on, it'll come back. When I do the identity imprint. Oh my God, it's gone. Sorry. I'll keep driving and it'll come back. So it has to do with the identity imprint, but I kind of lost my question. Sorry.
Okay.
Okay, I'll come back.
Is it just check? Oh, sorry, that's gone to everyone.
I can't do eye exercises while I'm driving.
That's okay. Okay, guys, check this out as well. If you're available this weekend and if you want to learn lots of stuff from lots of people, I'm doing 2 talks, one on marketing, basic content marketing, and then one on IEMT. Check out hypnosisonlinemeetups.com. It's a bit pricey to go, to be honest, but there are some really good speakers. Just check out the whole lineup. Like I say, I'm doing 2 one-hour sessions, and Adam Cox is there, and loads of really good people actually, all about hypnotherapy and trainings and basically marketing your hypnotherapy business. If the question was about when do you do the identity imprint, so basically to keep things simple, I do an I, me, self, you elicitation from the specific point that the client is having a problem in their life. So if they're having problems at work, I'll be okay. I want to really chunk down to find out what they mean by that. So when do you have a problem at work? Well, in meetings. Okay, so in meetings, when in particular, when my supervisors or when my superiors, sorry, are also in the meeting. Perfect. That's where I then get them to think about as I do the IME self-view elicitation from that point. Now, to further the identity work, you can then do the identity work around those superiors as well. So the identities of the other people. You can also see anything else that comes out when you're in this meeting. What's it like? I feel like a loser, or I am a loser, I am beneath them. So you can start to get some of the language of how they describe the situation as well, and then break that down using the appropriate eye movement patterns from there. So if it's I feel like a loser, obviously you go to the imprints, do the kinesthetics. And if it's I am a loser, and when's the first time you can remember being this way, and obviously doing the identity, the lazy 8 on these as well. So I just use the I, me, self-view as really kind of like a starting point with a lot of stuff as well, and then explore it from there. And then I always like to check it. So when you think about being in a meeting now, what's that like? And then you want to basically see what it's like. And then if you see them a week later, whatever it might be, allow them to go test the thing and see what happens, because you have to go do the thing basically with IEMT. It's not about thinking about something and feeling good. It's about changing what you're doing really, and changing the physical kinesthetic experiences and the identity changes as well. So I hope that answers your question. If it doesn't, please post it on the YouTube. Yeah, post on the YouTube and I will give you a better explanation. Okay, any other questions at all? Any other questions about IEMT, the training, or anything else? Anything else? Mavis. Oh, you're going. Oh, you go. Right, Mavis is going. See you later. Take care, Mavis. Bye.
Thank you. Brilliant. Really.
Thank you. Take care. See you later. Any other questions at all? Any other questions? Just checking the YouTube. We had some good viewing figures on there today. Any other questions?
Okay. Yeah, I really appreciate it. I think I got the concept that was helpful, that wasn't made clear to me. I didn't get it. Is when you say I feel like, then you would do identity imprint. But if you say I am, then you do more, and you ask for, is there I'm a loser? Let's say you were saying, this is where you would do more the complex pattern and ask them, do you recall an event, or do you recall? Is that what I understand?
Okay, nearly. So basically, when somebody says to me, I feel like a loser, or I feel stupid, I'm going to use the kinesthetic pattern, the complex kinesthetic pattern. So when you think about this feeling, how strong is this feeling of being a loser or feeling like a loser? 9 out of 10. And when's the first time you can remember feeling this way? And then I'll do it, you know, the 4 different imprints. And if somebody says, I am a loser, I'll be, okay, and when's the first time you can remember being this way? And once we get to the imprints, and generally when it's an identity imprint, it tends to be a period of time, as opposed to, it's like what Andy was saying about the analog and digital. I find the complex, the integrative kinesthetic pattern a digital thing, because we measure it in literal numbers, whole numbers on the SUG scales. When it's an identity, it's not necessarily a feeling, it's a way of being. So that's not necessarily, it's more analog as opposed to either being there or not. It's more of a concept. So what I try to do is I try to get them to the first time they can remember being this way. And this could be at 6th form, or it could be around the period that their dad left, or during exams. I don't know, but generally it could be more of a like a mulch of experiences rather than sort of very precise experiences. And I get them to hold on to that way of being as you move their eyes, allowing anything to come to mind, and that anchors them and brings them up into the present experience. And that's when you'll get like the age progression and things like that as well. I hope that makes sense.
Yeah, so can I ask one more question?
Yeah, of course you can. Yeah.
Okay, so I have a client, and the reason I'm really curious, I'm trying to figure out how to best approach that. So she has bladder issues at night, but she has no problem at all during the day. So, and we are, you know, checking with physiotherapist and all that stuff. But from what she's been sharing with me, and I understand, and I asked her, I said, would you like me to try IEMT? Because I'm a yoga therapist, so I try different patterns and different things. And I thought this would be a good idea for her to do IEMT because she recalls all the trauma of her mother being so strict about, you know, bedwetting and having accidents and all that stuff. So I think personally, she probably has absolutely nothing physically. It's just the anxiety. So she's not sleeping properly because she's always worried about the urges of going to the bathroom, etc. So that's where I thought that IEMT would be really helpful for her.
Yeah, and I've done some similar stuff to that. Absolutely, yeah.
Okay, good.
So what I would do is I'd say, when you think about going to bed now, what's it like thinking about going to bed? Oh, I'm fearful because this might happen. Okay, and how strong is this feeling, and how familiar, and when's the first time? And that's how I would then start to sort of break it up. So basically, when they think about going to bed and what feelings does it generate, then working with the feelings. And also, if it's an identity, what kind of person would have this kind of problem? I tend to use that question. It works quite well when somebody can't see their own identity issues. If you get them to project it onto another person or a different, you know, what do you think? If you found out somebody of this age has this problem, what would you think of them? Oh, I think that they are a mess, or they are a what? Because it's easier to say it about somebody else sometimes.
Yes.
And then you can work with that. So that's what I do. A very, very similar thing when it comes to nightmares as well. So it's the feelings and the scenarios and the identities. Also, a lot of people don't like falling asleep because it's a loss. It's a lack of control. It's a loss of control over your body. And so it's basically you are at the hands. You're a victim to other people. So basically, you're vulnerable. Essentially, that's what I'm trying to get to. So it's the vulnerability, the inability to defend yourself, and then people wake up screaming when they get, you know. So if you work on those kind of issues, you'll tend to find that people's dreams just become quite boring, and they're able to actually sleep through much better as well. So that's what I would do. I'd always go looking for, when you think about going to bed, what's that like, and explore it from there.
Okay. And so when you ask that question, do you do the infinity loop, or do you do the complex pattern, or the kinetics?
Do I do the what, or the kinesthetic? Sorry?
The infinity loop.
Oh, so if it's a feeling, I always do the kinesthetic. So if it's a feeling, I do the straight lines. And if it's an identity, I do the infinity.
Yes. Okay. Okay.
So it's very easy to determine, because they will tell you I feel or I am.
Okay.
Make sense?
Okay. Yes, totally. Excellent. Thank you very much.
You're very welcome. Any final questions at all?
I'm done.
You're done. Okay. See you later. Any other final questions? If not, I am going to finish this. Well, guys, thank you so much once again for joining me. It's been really insightful. I'll get Andy on again as well. And if you have any people that you want me to interview, or if you want me to interview you, drop me an email, matt@iemtacademy.com. All right, see you later. Take care, Robert. Thank you for joining. I'll see you all later, guys. I'll send you out a replay as well, okay? Well, thank you all very much. See you later. Take care.
Thank you. Have a great day. Bye-bye.
See you all later, guys.